So this patient falls into the neck pain with coordination impairments, or WAD, and she is in the subacute phase. So this patient got injured because she came to a stop and then another person ran into her back, making her head go forward and backward, which is a whiplash. And then she is in the subacute phase because it's been 10 days since the injury, and she only has pain during mid-range to end range of movement. Patients in this category will have some dizziness, nausea, they have some headaches, and they have sensitivity to the light, odors, or some other things. And patients in the acute phase will just teach them, educate them. We'll have them stay active and try to minimize the use of the color. And then in the subacute phase, patients could start some range of movement exercise, some isometrics, stretching. And then for the chronic phase, we will continue those exercises, but we could add more resistance and more functional exercises and coordination exercises for the vestibular system, and then we could add TENS to alleviate the pain in the neck. So this patient scored really low on the neck disability test, which was 46%, which she has a lot of pain on the neck. And then they also did the deep neck flexor test, which has a positive, and that test is to test the deep neck flexor muscles. And then they also did sensory test for the triceps and biceps, and they also did soft tissue tests, which she had some tenderness and pain on the upper traps and levator scapulae and the sternocleidomastoid. And then they did some MMT to test the shoulder and the elbows. So what some exercises this patient could do is, since she is in the subacute phase, we could start introducing isometrics, range of movement exercise, stretching. And for today, this session, I will demonstrate 2 exercise, which the ones I chose for her condition that will help her more. It will be isometrics for the neck, which she will hold for 10 seconds going this way to the right, hold it for 10 seconds, and then to the left, and hold it for 10 seconds, and then flexion, she will hold it for 10 seconds, and then extension, she will hold it for 10 seconds, and then she will do lateral flexion to the right, hold it 10 seconds, and then to the left, and she will hold it 10 seconds also. So those exercises for isometrics will help her strengthen the muscles on her neck. And then another exercise she could do is stretching for the upper traps, because she has tightness on the upper traps. And she will go like this and then hold it for 30 seconds to stretch the upper trap. Once the 30 seconds are done, she will go like that to the other side and then stretch the other side of the upper trap and hold it for 30 seconds. So those 2 exercises, I think they will help her, because one is to strengthen the neck, and then the other to relieve the tightness on her upper traps so she could get more mobility.